Assalamu alaikum. Professor Ibrar Hussain here from Pakistan. Today I am going to show you surgical tightening of the lower eyelid in a patient with permanent right seventh nerve palsy with loose hanging lower lid and exposure keratitis. This 25 years old male had a road traffic accident 3 years back when he developed injury to the right facial nerve and developed permanent palsy. He was unable to close the right eye and gradually developed right exposure keratitis. Right lower eyelid was loose and sagging down, thereby exposing the inferior cornea and sclera even when the eye was closed. Right lower lid entropion was also there. We decided to reconstruct the medial canthus. For this purpose, first of all, the extra skin in the medial canthus, which was adherent to the conjunctiva, was excised. To reconstruct the medial canthus, I took first bite from the medial canthal tendon using 5/0 vicryl suture. Then needle passed through the medial end of the upper lid from medial to lateral, and finally from medial end of the lower lid from lateral to medial. Tightening of this suture pulled the medial end of the lower lid up to its natural position, and medial canthus beautifully formed. This also reduced the lower lid entropion. 2 to 3 more 5/0 vicryl interrupted sutures applied to fill the gaps. At lateral canthus, we performed lateral tarsal strip procedure to tighten the lower lid. For this purpose, we performed lateral canthotomy and then inferior cantholysis. Lateral end of the right lower lid was split into anterior and posterior lamellae. Thin marginal strips from both lamellae excised. Then lateral tarsal strip was prepared from tarsal plate and conjunctiva from its inner surface scraped. Then 5/0 vicryl suture passed through the strip and knots applied. The needle then passed through the periosteum of the inner part of the lateral orbital margin. The suture tightened and knot applied. This suture stretches the lower lid and make it tight and elevated. Then lateral canthus is formed by stitching together the lateral ends of lower and upper eyelids. Rest of the canthotomy wound is repaired by 2 to 3 interrupted 5 ovical sutures. This stretching of the lower lid also corrects entropion. These are the results of the procedure with open and closed eyes. The exposed ocular surface is well covered, especially when the eye is closed. Lower lid entropion is also addressed. Thanks for watching this video. Please subscribe the channel.